Good afternoon. I'm going to take my mask off since I'm in a non-clinical space here at OU Health today, and I'm with my two colleagues who are both fully vaccinated, as am I. So take my mask off today for the briefing. So I'm Dr. Dale Bratzler. I'm the Chief Quality Officer for OU Health, and I'm also the university's Chief COVID Officer. I'm going to go through the data that we have today, though I won't spend much time on data since mostly very, very good news about the current cases in Oklahoma. And then just going to talk about some other topics that I found of interest in the medical literature this week. So Oklahoma continues to do quite well. Oklahoma is at 3 cases per 100,000 per day. We currently rank, I believe, 38th in the nation in terms of the total number of new cases per day. Our number has gone up a bit, but the reality is that there are a lot of states that are bunched around 2 to 3 cases per 100,000 per day, which is a quite low rate of new cases. The state with the highest rate right now is Wyoming at 13, but the worst place to go is the U.S. territory, the U.S. Virgin Islands, which is at 19 cases per 100,000 population per day, but that means that they have about 19 cases per day for the islands. Oklahoma is now just over 454,000 cases, and I think most are aware that 24 new deaths were reported today, preliminary deaths by the CDC, so that puts us up well over 8,000 deaths in our state. If you look at the 7-day rolling average, I plotted it out over the past 14 days. You can see for the past 9 days, it's been completely flat, right at about 117 new cases a day in the state per the 7-day rolling average. We seem to have really flattened out for those cases. The number of cases per county remains quite low. There is variation, but some of the small counties, just a few cases changes their population incidence quite a bit. Oklahoma County's at only 2 cases per 100,000 population per day. Cleveland County's down to 1 case per 100,000 per day, and Tulsa has a few more cases on a daily basis. They're at 4 cases per 100,000 per day. Hospitalizations remain very stable. Just over 100 people in acute care hospital beds in the state, and very consistently, about a third of those patients are in the intensive care unit. In our system, we actually had a day this past week where we had no ICU candidate patients with COVID-19, which was the first time in a long time we had nobody in our ICUs with COVID-19. So I'm just going to highlight a few things that I noticed. One was this morning, I was looking at some of the medical news, and one of the things they highlighted that 2020 was the deadliest year in U.S. health history. More deaths in the United States in 2020 than we've ever seen before, primarily because of COVID-19. And 2 weeks ago, I'd highlighted in a graphic that showed this tremendous increase in the number of deaths in 2020 from COVID-19. But the other point that they made in this discussion this morning was that the number of deaths from cardiovascular disease and diabetes also peaked in 2019. And though those aren't COVID-19 deaths, they're very likely contributed to by COVID-19 because people have delayed care or deferred care. So people didn't go to the emergency room when they were having cardiac symptoms or chest pain because they were scared that they might get COVID-19. So I think the impact of COVID-19 was profound for the mortality rate in the United States in 2020. And again, the overall life expectancy of all Americans dropped by a full year just in 2020 alone. We're still seeing in the United States somewhere around 2,500 deaths per week. So we're clearly not completely done with COVID-19. And again, I think all of us in healthcare have concern that there will be a lot of people that have delayed or deferred care. So I encourage people, see your physician, get your preventive services, vaccines, colonoscopies, mammograms, and get preventive health services so that you don't end up with more severe disease down the road. Excuse me. I put in a slide that just highlights the new names for the variants, which I will use the new names. The Delta variant is the one that we're most concerned about. At the moment, it's the one that we used to call the India variant. Contagious. There's been a lot of press about it lately. So remember, in the UK, they had a variant strain that completely took over their country, and now the Delta variant is taking over new cases in the UK and is the predominant strain in the UK. 6% of the cases that have been diagnosed in the United States are with the Delta variant, and there's a couple of points that are really important to remember. So I mentioned it's more contagious, 40 to 50% more contagious. But also, if you've only had one dose of the Pfizer or the Moderna vaccine, that appears to be only about 33% protective. And if you've had both doses, you're fully vaccinated, you're more than 2 weeks past the second dose, it's only about 88% effective. So this particular strain of the virus seems to cause more hospitalization, spreads easier, and you're not quite as protected quite as well with vaccine. In Oklahoma, we have seen cases of the Delta variant in Oklahomans who've been fully vaccinated. So just remember, vaccination is the most important approach. It dramatically reduces the risk of severe disease and does decrease your likelihood of being infected with one of the variant strains, but doesn't give you complete protection. No vaccine is 100% effective. Again, the other vaccines like AstraZeneca or Johnson & Johnson are only about 60% effective against the Delta variant. So just remember that, and we need to watch it carefully to see if we see any spike or increase in new cases in Oklahoma. I put in a table that comes directly from the weekly epidemiologic report produced by the State Health Department that highlights the variant strains in Oklahoma. There have been 30 cases confirmed of the Delta variant in Oklahoma, so the numbers remain low. But again, if we see the same type of spread that other countries have, it could become a predominant strain in the state. On vaccines, so that takes me to vaccines, thinking about how can we slow the spread of COVID-19 in Oklahoma. And I think a couple of things that I'm a bit concerned about. So at least data from the State Health Department out of the weekly epidemiologic report showed that only 42% of Oklahomans have had at least one dose of vaccine. Of those people 12 and older, and only 35% are fully vaccinated. But what's more important to me is the proportion of the various populations. So 65% of people 65 years of age and older are vaccinated, which is very good, approaching 70%. But when you look at young people, the people who are most likely to get infected with COVID-19, the most likely to spread it, to potentially take it to other people who aren't vaccinated, it's that young population. And there, in that 18 to 35 age group, only about 19% of that population is fully vaccinated. And of course, we just recently started with the 12 to 17-year-olds, and those percentages are very, very low at this point. So we have a lot of room for improvement in terms of vaccination. No more than half of Oklahomans have had at least one dose of vaccine at this time. I recognize there are all different sources of data on vaccine, CDC, Oklahoma State Health Department, so the numbers vary from report to report. But we're nowhere near to the president's goal of 70% vaccination. We have quite a ways to go. And in particular, I do have concerns that if we get to the fall, and we're bringing students back together, those younger age groups, and those vaccination rates in those age groups remains quite low, that we could see spread of the disease once again. So something we really need to work on a lot, and that's encouraging young people to be vaccinated. I saw a very interesting report yesterday about blood clots, particularly related to the COVID vaccine. So big in the press a few weeks ago was the incidence of these brain blood clots that occurred after the Johnson & Johnson vaccine. The CDC reported about 7 cases out of 6 million doses of the vaccine, so the incidence was quite low. It was 0.9% with the Johnson & Johnson vaccine. But what this particular study, there were 2 studies that came out, one from the UK, one from Harvard, that looked at what's the incidence of having these brain blood clots in the community, or if you get COVID-19. And the important thing was the background U.S. rate of these blood clots was about 2.4 per million people. That rate, that's an estimate. That number has been reported to be as low as 0.5. But in other words, the incidence of those brain blood clots with the Johnson & Johnson vaccine really doesn't appear to be much greater than the incidence in the general community of people, because these things happen to people all the time. It's not common, but it doesn't appear to be much greater with the Johnson & Johnson vaccine. Similarly, the AstraZeneca vaccine, which we don't use in the United States, they were at about 3.6 cases per million doses of the vaccine. But in the one study from the United States that looked at people who have COVID-19, the incidence was 42 cases per million. And the lowest estimates I've seen is that if you get COVID-19, your risk of having one of those brain clots is 7 times higher than the risk of getting a brain blood clot by being vaccinated. So again, I'm going to highlight over and over again, you don't want to get COVID. You don't want to end up in a hospital with COVID, because the complications can be very substantial. COVID induces all sorts of changes like blood clots, strokes, heart attacks, and other things that can occur, and the vaccines are far, far safer than ever getting COVID-19. So again, putting it into perspective, the risk from the vaccine for this particular side effect is incredibly low, not much different than we see in the general population, but far less than we see in people who get a diagnosis of COVID-19. And then finally, I put in several handouts just to talk about the syndrome, long haul syndrome. The medical term for it now is post-acute sequelae of COVID-19, PASC syndrome, and it's very, very common. And I gave a lecture on it to a medical organization recently, and I highlighted a couple of points. There are so many medical articles on the long haul syndrome now that the rate in the population, how common it is, varies by the number of papers that have been published on the topic, because they all look at different metrics, different populations, based on surveys or other things. So it's unclear how common long haul syndrome is after a person has COVID-19. It certainly seems to be no less than 10%. I used in my estimates 15%, but it turns out that the sicker you are, the more likely you are to have long haul type of symptoms. So studies from the University of Michigan, where they looked at patients who were hospitalized, found that about a third of them had long haul symptoms. And a study from Italy early in the pandemic showed that in their patients who were sick enough to be in the ICU, 87% reported long-term symptoms. The definition is symptoms that last more than 28 days after you've recovered from COVID-19. It's been reported in all age groups, young children to the elderly. In studies that have actually looked at population incidence, it's more common the older you are, so your risk of having long-haul symptoms. And now, the interesting thing is, long-haul symptoms have been reported in people who think they had COVID, but just never got a test done, or when they happened to get their test done, the test came back negative. So they had all the symptoms, but they never ended up in a hospital. They never had a positive test, which has been very, very challenging for healthcare, because there is skepticism about you can't have long haul, you've never had a positive test. And in fact, there are numerous studies that have been looking at this now, and there are probably people who've had, well, in fact, we know there are a lot of people who've had COVID-19 who simply never went out and got a test done, but those people may well have long haul symptoms. One of the best studies I've seen that came out of the UK and out of Massachusetts looked at people who used an app after COVID to keep track of their symptoms. And in that particular study, 13% of the people had symptoms that lasted more than 28 days, 4.5% had symptoms that lasted more than 8 weeks, and 2.3% of the people using the app for reporting had symptoms that lasted more than 12 weeks. So I just used a rough estimate. What if 15% of COVID patients develop long-haul syndrome? If you just look at people who've had a positive test, let's not even think about all the people out there who had COVID but never got a test done, that would mean we'd see 2 million cases of PASC syndrome or long-haul syndrome in the United States, and some 68,000 Oklahomans would likely have long-haul symptoms. So it's going to be common. Lots of primary care physicians are going to be seeing these patients. And again, those numbers are based only on people who had a positive test from long haul symptom. So those are the key points I wanted to make. Again, I want to highlight a couple of other things. Had interesting conversation with one of our pediatric hospitalists this morning. We're seeing a big outbreak again of RSV infection in kids. Remember, through the winter months when our children's hospitals are typically full of RSV, which is another viral respiratory infection, we didn't see many. In fact, we hardly saw any. OU Medicine only had 3 positive flu tests through the whole flu season. But now, for the past month, we're seeing increasing numbers of children being admitted to our children's hospital with RSV. So it correlates with 2 things, we think. One is that kids did go back to school, at least temporarily, before the end of the school year, and that may have increased spread of RSV. And then second, mask mandates went away. Again, RSV, para-influenza, COVID-19, influenza, they're all respiratory viruses that spread by breathing in air that came out of somebody else's mouth, and now we're starting to see a big uptick in the number of RSV cases in our children's hospital. So again, I think when it gets to flu season next year, I think a lot of us will have to think, is it worth it to keep wearing a mask to prevent the spread of some of these diseases? So I'll take some questions.
And RSV season is usually like finishes by March, kind of like similar to flu, right? So this is a really unusual time to have
Yes.
taking cases.
Yes, RSV typically occurs in the winter months in Oklahoma. So I just know that our children's hospital also really has an increased number of admissions through the winter months due to RSV, respiratory syncytial virus. So this is very, very late to be seeing an outbreak. Again, we don't know, but those are a couple of things that happened. Schools did open up again, and we did see people quit wearing masks, and that may have had some impact on spread of that particular respiratory virus.
Okay, can you tell us where we are nationally? You talked about nationally in terms of new cases, but where do we rank for vaccinations right now?
Yeah, so the question is about vaccinations and where do we rank nationally. I haven't pulled down, I can pull down from the CDC a list and actually rank Oklahoma. We started out very, very high because we really did a good job of rolling out the vaccine quickly in Oklahoma, but other states caught up with us. The last time I looked, we were, I want to say, 33rd or so in the nation in terms of total vaccination rate. But again, I think the important point is that only about half of Oklahomans have had at least 1 dose of the COVID vaccine. We're nowhere near 70% in our state. And when you look at the age distribution of vaccine, we've done a pretty good job in the elderly, and appropriately so. They're the ones who get hospitalized or have complications of the disease. But we still have a lot of young people that have not been vaccinated yet. And while they don't typically get as sick, they can get very sick, and they can spread the disease to others.
And I know maybe you haven't looked at the numbers lately, but so were there some counties that were like almost 0 vaccines? I mean, there were some really bad counties, right?
Yeah, the question's about county level vaccination rates. I haven't looked at that data in a while. I know the metropolitan counties had higher rates of vaccination than some of the rural counties. I don't know. I haven't seen any ranking recently.
All right, let's talk about the long haul syndrome a little bit more. I don't know if you have it broken out by some of your information by some of this stuff, but for people with smell and taste issues, is there any hope? Somebody who had it 6 months, COVID 6 months ago, is still having trouble smelling things.
Correct. So the question is about long haul syndrome, particularly the loss of taste and smell, which is a common symptom of COVID-19. Interestingly, doesn't necessarily correlate with severity of illness. It will occur in people who stay at home, never go to the hospital, but the loss of taste and smell is a very common symptom, and it's one of the common long-haul symptoms that occur with COVID-19. It appears to be that the virus actually infects the neurons, the nerves that control your ability to taste and smell. And the symptoms can last for very long periods of time. In fact, there are concerns that some people may have permanent loss of taste and smell. What I have found is that some people will have long periods of time when they don't, and then they'll have the symptoms that they'll smell things that seem funny. They'll start to have a sensation of smell, but it'll be one person I know had burnt paper, or smoke. That sensation of just smelling smoke all the time as slowly the symptoms are starting to resolve. I don't know of any confirmed treatment that's been shown to cure the syndrome. I know there are lots of things that are being tried by our ear, nose, and throat colleagues, but the symptoms can last for long periods of time, and some people may end up having permanent loss.
Someone was asking just what other post-COVID symptoms are you hearing about? She specifically mentioned that they talked to somebody who had tachycardia and is very tired all the time. Are there some other more common things?
Yeah, so some of the most common symptoms that occur as a part of long haul syndrome include fatigue. Very, very similar description that patients have around chronic fatigue syndrome. So fatigue is quite common. Muscle aches, joint aches, low-grade fevers, headaches, some shortness of breath, even if the x-rays look normal. Some people complain of shortness of breath. We mentioned loss of taste and smell. Those are probably the most common symptoms that occur, but chronic fatigue is definitely one. One syndrome that's a bit interesting is this postural orthostatic tachycardia syndrome, where some people, when they stand up, will feel their heart rates. They get lightheaded and sometimes even pass out. That appears to be also related to previous COVID infection.
Okay, let's move on to herd immunity. Some viewers seem to believe we've already reached herd immunity. Please elaborate, and what does it take to reach herd immunity? Are we close, and when can we get there?
So herd immunity, I was commenting to April earlier that herd immunity is something we talk about a lot, but I'm not sure anybody knows exactly how to define. So if you base conversations about herd immunity only on vaccination, then we're not there. We're close to the numbers that we think you would need to get to prevent the virus from spreading from one person to another. And that's the concept of herd immunity. If you have enough people in the community who are actually, have immunity to the virus, whether it's from previous infection or from being vaccinated, you can see a reduction in the transmission from person to person, because when an infected person comes into the room, it's harder for them to run into somebody else that hasn't already got immunity, and so the virus doesn't spread as easily. But there are a couple of concepts about herd immunity that are important to remember. I think we are learning that people who have previously had COVID do have some degree of long-term protection. We don't know yet how long. We don't know yet whether it will be as good for variant strains as the vaccines are, but they definitely have some long-term protection. And we've estimated in the past that up to half of Oklahomans may have had COVID-19 when we went through that huge surge in December, January, February. Because remember, a lot of people who had COVID-19 never had any symptoms, didn't go to the doctor, didn't get a test done, or had minimal symptoms and just thought they had a cold. And so there are a lot of people out there that had COVID that never got a test done, that won't show up in the state's numbers. Those people likely do have some degree of immunity to the virus. And then you add on that 50% or so of Oklahomans that have had at least one dose of the COVID vaccine, and the combined two may put our numbers of people with some degree of immunity pretty high. And so a couple of months ago, I think, in one of our press briefings, I highlighted an article by Marty McRae from Johns Hopkins, who said there's only one way in the United States to account for this plummeting number of cases, and that's that we've achieved some degree of, quote, herd immunity, because we had so many people in the United States that got the infection, and then we've added on a bunch of vaccines on top of that. Now, there are a couple of caveats I want to mention. One is that we don't know, I mentioned that we don't know how well long-term protection will occur with previous infection, or whether that will be as protective against variant strains. But the other one is, remember that if we get to 70% herd immunity or 80% in Oklahoma, that assumes that everybody across the whole state is evenly immune. And we know that's not the case. We know that you can change zip codes within Oklahoma City and find different rates of vaccination, previous infection. And so, in some zip codes, lots of people have received the vaccine. In other zip codes, very few. So, and that's where we still see quite a few cases. So herd immunity, it sometimes gets this broad brush. Well, we hit 70%, that's great. But there may be populations, there may be counties in Oklahoma that are at 20% or 30%, and they clearly haven't achieved herd immunity.
Realistically, how long will it take for the state to get those 18-year-olds and up with one shot up to 70% vaccination mark? She was saying that we were at 54% and that took 6 months.
Yeah, so again, it depends on what your data source is in terms of vaccination. But when you look at that age group, they have the lowest rates of vaccination. So I mentioned the 15 to 35-year-old age group, I believe, or 18 to 35, they're only at 19% fully vaccinated in Oklahoma. And again, that's data that comes straight from the state health department. You can go to the CDC website. The numbers there are a bit higher because they include all the tribal numbers, which is important. But even with that, it's still not much more than 50% of our population has been vaccinated. But 70% of our 65 and older have been, but our young people are far from the number of 70%. I think it's going to take a long time unless we see a substantial increase in the number of people seeking the vaccine. You know, the issue I hear sometimes from parents of university students and others is, I don't want to get the kid vaccinated because we know COVID doesn't affect kids very much. They don't get as sick. They're not nearly as likely to be in the hospital. That's true, but the rate isn't zero. They can get it, but they can spread it to other people. And I think that's the point that a lot of the experts are talking about is we need, if we're going to get to this concept of true herd immunity, we have to get as many people vaccinated as possible. So I think it's going to take us quite a while to get that 12 to 17 age group vaccinated.
So that leads us into the younger even younger than 12. Right now it's emergency use authorizations for 12 and up, but what do we think, do you think, have you seen any data that shows when we'll have a vaccine for the young? I know they're still testing.
Yeah, so this week Pfizer announced that they hope to present their data on the 6-month through 11-year age group to the FDA sometime by September. Right now they're doing the dose finding studies because we won't use the same dose of the vaccine in kids that we use in adults. So they're doing those studies, but they're hoping to be ready to present data to the FDA by September, perhaps October.
But the vaccine that we're giving the 12 and up, that is the same dose, right?
It is the same dose. 12 and over, we still give the exact same dose.
Okay. And so still speaking of kids, this question is, what do health experts recommend for kids and babies who are too young to be vaccinated in terms of being around adults who aren't vaccinated?
Yeah, so the question is about what do you do to protect your kids that are below the age of 12, so they're not eligible for vaccine, and you want to protect them from getting the virus. So I had this question earlier from a group on the university campus, and I basically said the most important thing is to make sure that the household contacts are all vaccinated. That's the most important thing, because we know when you're fully vaccinated, your chance of asymptomatic spread of the virus goes down dramatically. I think, as I highlighted with them, I would still, when your kids go back to school in the fall, I personally would still encourage them to wear a mask. Oklahoma won't allow us to mandate it, but I would strongly encourage you as parents to recommend that your children wear a mask. Anytime they go into events that are indoors around a lot of people, because if you're in K through 12, a lot of those kids will not be vaccinated in the fall because it won't be available. When they're coming back indoors and around other kids, wearing a mask could be very, very helpful. I think that's the most important thing. Think about the situations that your kids are in. If they're going to a big party with a lot of people and it's indoors, that's where this virus transmits most easily. If it's outdoor events, the risk is quite low.
That is all of the questions that we have today. Is there anything you want to add?
Nothing else.